So, you've probably heard of aspirin. It's that little white pill that shows up when you have a headache or a fever. But what is it, really? Aspirin is a medicine, and its scientific name is acetylsalicylic acid. That's a mouthful, I know. For thousands of years, people used the bark of the willow tree to help with pain and fever. It turns out, willow bark has something similar to aspirin in it, called salicin. It was a natural remedy that worked, and modern science just found a way to make it better and put it in a convenient little tablet for all of us. The story of aspirin is a great example of how we take something from nature and turn it into a medicine we can use reliably. Think about it. Chewing on a piece of tree bark isn't super practical, and you'd never know exactly how much of the good stuff you were getting. A scientist named Felix Hoffmann, working for a company called Bayer in Germany, figured out how to create a stable, effective version in the late 1890s. This process, called synthesis, allows us to make huge amounts of pure aspirin so that it's available and affordable for people all over the world. This little pill is one of the most common drugs on the planet. People use it for all sorts of things, not just for that annoying headache after staring at a screen for too long. It's a pain reliever, which is called an analgesic. It's also a fever reducer, known as an antipyretic. And it fights inflammation, which is that swelling and redness you get when you injure yourself. It's like a Swiss Army knife for common aches and pains, all packed into one tiny, easy-to-swallow pill. It's pretty amazing chemical engineering when you stop to think about it. So, at its core, aspirin is a synthetic drug with roots deep in natural history. It's a non-steroidal anti-inflammatory drug, or NSAID for short. This just means it's a type of painkiller that isn't a steroid. It works by blocking certain chemicals in your body called prostaglandins. These prostaglandins are the troublemakers that send pain signals to your brain and cause inflammation and fever. Aspirin basically tells them to take a hike, giving you relief. It's a simple but incredibly effective mechanism that has made a huge difference in people's daily lives for over a century. Okay, so how do you actually make this stuff? Let's put on our imaginary lab coats. Making aspirin in a laboratory is a classic chemistry experiment. It's all about a chemical reaction called esterification. The main ingredients you need are salicylic acid and acetic anhydride. Salicylic acid is the stuff that's similar to what's in the willow bark, but it can be pretty harsh on your stomach. The acetic anhydride is what we use to change it into the gentler, more effective form we know as aspirin. You also need a little bit of an acid, like sulfuric or phosphoric acid, to act as a catalyst, which just means it helps speed up the reaction. First, you would carefully measure out your salicylic acid, which is a white crystalline powder. Then you would add the acetic anhydride, which is a clear liquid with a very strong vinegar-like smell. Seriously, it's pungent. You mix these two together in a flask. Then you very carefully add a few drops of your acid catalyst. This mixture is then gently heated, often in a warm water bath, for about 10 to 15 minutes. The heat provides the energy needed for the molecules to start reacting with each other and rearrange themselves into something new: acetylsalicylic acid. After heating, the reaction should be complete. But now you have a hot, soupy mix of your new aspirin, leftover chemicals, and byproducts. To get the aspirin out, you need to cool the mixture down. You carefully add some cold water, which does two things. It destroys any leftover acetic anhydride, and it makes the aspirin, which doesn't dissolve well in water, start to form solid crystals. To speed this up, you might even place the flask in an ice bath. You'll start to see beautiful white crystals of aspirin appearing in the flask as it gets colder. Finally, you have to separate your solid aspirin crystals from the liquid. This is done through a process called suction filtration. You pour the whole slushy mixture through a special funnel with a piece of filter paper in it. The liquid gets sucked through, but the solid aspirin crystals are left behind on the paper. You then wash the crystals with a little bit of ice-cold water to rinse away any remaining impurities. After letting them dry completely, you're left with your very own batch of crude aspirin. It's a pretty straightforward process, but it shows how we can transform one chemical into another. Aspirin is famous for its three main jobs: relieving pain, reducing fever, and calming inflammation. If you have a tension headache, muscle soreness from a workout, or toothache, a low dose of aspirin can often provide relief. It works by blocking the production of those prostaglandin chemicals I mentioned earlier. These chemicals are released when your body's cells are damaged, and they are a big part of what makes you feel pain. By putting a stop to them, aspirin effectively turns down the volume on your body's pain signals, making you feel a lot more comfortable while you heal. Beyond everyday aches, aspirin has a more serious and life-saving role. Doctors often prescribe a low daily dose of aspirin for people who are at high risk for heart attacks or strokes. This is because aspirin also has an antiplatelet effect. Platelets are tiny cells in your blood that rush to the site of an injury to form a clot and stop bleeding. Sometimes, however, these clots can form inside your blood vessels, blocking blood flow to the heart or brain. Aspirin makes the platelets less sticky, so they are less likely to clump together and form these dangerous clots. This anti-clotting ability is a huge deal for cardiovascular health. For someone who has already had a heart attack or a certain type of stroke, taking a daily low-dose aspirin can significantly reduce the risk of having another one. It's a key part of what's called secondary prevention. It's also sometimes used in primary prevention for people who haven't had a cardiovascular event but have multiple risk factors. This decision, however, must always be made with a doctor, as it involves balancing the benefits against the potential risks of the medication. And the research doesn't stop there. Scientists are constantly exploring other potential benefits of aspirin. Some studies have suggested that long-term, regular use of aspirin might be associated with a lower risk of certain types of cancer, particularly colorectal cancer. The idea is that the same anti-inflammatory properties that help with a swollen ankle might also help prevent the chronic inflammation that can contribute to cancer development. This research is still ongoing and complex, but it shows that this century-old drug might still have some new tricks up its sleeve. Of course, no medicine is perfect, and aspirin is no exception. It has side effects, and it's important to be aware of them. The most common issue is stomach irritation. Because aspirin blocks prostaglandins, and some of those prostaglandins actually help protect the lining of your stomach from its own acid, taking aspirin can lead to stomach pain, heartburn, or nausea. For some people, especially with long-term use or at high doses, this can even lead to more serious problems like stomach ulcers or bleeding. This is the main reason you should always take aspirin with food and a full glass of water. The same property that makes aspirin a lifesaver for preventing blood clots can also be a significant risk. By making your platelets less sticky, aspirin can increase your risk of bleeding. This could be something minor, like bruising more easily, or a nosebleed that lasts longer than usual. However, it can also be very serious, like bleeding in the stomach, intestines, or even the brain. This is why doctors are very careful when prescribing aspirin to people who are already on other blood-thinning medications or who have conditions that increase their bleeding risk. It's a delicate balancing act. Another very important, though rare, side effect is a condition called Reye's syndrome. This is a serious illness that can cause swelling in the liver and brain. It almost exclusively affects children and teenagers who are recovering from a viral infection, like the flu or chickenpox. Because of this link, you should never, ever give aspirin to children or teenagers who have a fever or viral illness unless specifically told to do so by a doctor. This is why other pain relievers and fever reducers like acetaminophen or ibuprofen are usually recommended for kids instead. So, while aspirin is an incredibly useful tool in our medical toolbox, it's not for everyone or for every situation. Taking it for a simple headache every now and then is generally safe for most adults. But using it daily for prevention is a decision that requires a serious conversation with a healthcare professional. They can help you weigh your personal benefits against your personal risks. Aspirin is a powerful drug, and like any power, it needs to be used wisely and with respect for both its benefits and its potential to cause harm.